Hi everybody, thanks for coming. Headaches is obviously a humongous topic, and a neurologist could go in a lot more depth, but I'm going to talk to you from kind of the family doctor perspective, the most common things we see, and go over the most common types of headaches. There are multiple types of headaches, and we're just going to hit the most common ones. I'm going to see if I can figure this out. I haven't practiced. Okay. So what exactly is a headache? Pain anywhere in the head or neck region. The brain tissue itself, the gray matter, white matter, has no pain receptors. So the pain is actually coming from pain receptors in other parts of your head or neck, be it the skin, muscles, scalp, blood vessels, whatever. And those can be inside or outside of the cranium itself, your head. So this was an archaic depiction of a headache, but it may feel pretty accurate to some of you who suffer from them. There are over 200 different types, like I said, a lot. The most common types, and what we think of mostly headaches, are the primary headache disorders, those that aren't due to another cause. Those are the tension type headaches, migraines, and cluster headaches. And then occasionally people will have what's called a secondary headache. Obviously those are sometimes what physicians worry about that are due to another cause. Could be dangerous, it could not be, it could be benign. So the primary headaches, these are the common locations. Tension headache you see in a band around the head and the neck. A cluster headache, they have it depicted here as a woman, but it's much more frequent in men. We'll talk about that a little more later. But that's usually around one eye or the other. And then a migraine headache is usually one side of the head or the other. So 90+% of the general population has a headache at least once a year. I'd say most of us get them a bit more frequently than that. And most of these are easily managed with over-the-counter type medicines that you could probably already have at home or carry around in your purse, or your wife may carry in her purse. Most of the headaches that people experience are the primary type, and most of those are the tension type headaches, the band-like headache around your head or going down into your neck. Migraines are a pretty common thing, but depending on the population you look at worldwide, between 5 and 20% of the population can suffer from migraine headaches. They are more common in women than in men. And then the cluster headaches of the primary headache disorders, as I said, are a lot rarer. They're actually less than 0.5% of the population, but they are severe and they occur in men. Can everybody hear me okay? Okay, great. So to talk a little bit about tension type headaches, these are the most common type of headache. They're generally non-throbbing, just a constant kind of ache, mild to moderate, and on both sides of the head or in a circumference around your head in a circle. They're the least studied type, probably because the pain isn't as severe, and they're very common. And then there are multiple classifications, which is always true of anything in medicine. I'm sure you've realized we have to classify everything. Infrequent episodic, this is the most common type of tension headache that people suffer from, and that's less than 1 day a month. You could fall into the category of frequent episodic headaches, which means 1 to 14 days a month, so less than half the time you'll have one, or chronic, which is more than half the time you have a headache. So both sides of your head. The causes of most types of headache are not really known. There are theories and postulates, and these go in and out of fashion over the years. But they think that these are multifactorial or due to more than one type of cause. They also think that these change from person to person. Your headache may be caused by something different than mine, and each individual tension headache you get could be caused by a different cause. They think, especially in people who get chronic headaches, that there's an increased sensitivity of those pain fibers that do send the message to your brain to make you think that your brain is actually hurting, even though it's something else around or in your head elsewhere. And that these nerves start firing more and more, or that things that shouldn't be painful, sensory stimuli, or things that should just be kind of tuned out by your pain centers, start triggering pain sensation when they shouldn't. For the less common headaches, people who don't suffer from headaches all the time, they may be triggered by muscle tension or muscle pain. Like if you get a neck ache, it radiates up into your head. Genetic factors aren't as important, so these aren't as inherited as other headache disorders such as migraines, but they may play more of a role in those people who do develop the chronic headaches, who get oversensitized. So these are common descriptors that you may experience or use to describe your headaches, such as dull, pressure, band-like, fullness. Some people said their head feels kind of like a balloon, a weight of your head and shoulders, or a tight cap or hat. And like I said, they're often associated with muscle tenderness in that region as well. So if you do present to a doctor, how will they diagnose that's what's going on? It's generally based on your clinical impression. These can fairly reliably be distinguished from a dangerous condition, but not all the time. And there's no specific testing where they can run a test and say, yep, you have a tension headache. The pain can last for days, up to a week, from a single tension headache. That's unfortunate, but and hopefully rare, but it can happen. And then while your physician will do your exam, they're looking for any neurologic abnormalities, and if they see one, they may need to run a test. A headache diary where you keep track of when you get your headaches, how often, the symptoms that you're having, and what you've done or eaten around then can sometimes help your doctor distinguish what type of headache you're having if they're having a hard time based on your initial presentation. So treatment. The biggest treatment is treat early, and you have to be careful to prevent medication overuse headache. I'll talk a little bit about that later, but this is more and more common in our society, that people treat themselves for relatively frequent headaches, and the medicines that they use are being overused and can actually cause more headaches, and it's a vicious cycle. If you do have infrequent headaches, then just using symptom-based treatment is what you should do. You have a headache, you take a pill. If they are frequent or you know, everyday kind of thing, you should probably talk to your doctor about getting on preventative treatment. Those aren't over-the-counter medications, and I'll talk a little bit about them. This is Moses's headache prescription. So let's see. Symptomatic treatments such as, you know, Motrin, ibuprofen, Advil are the medications that we're all familiar with as your standard headache medicines. These are just simple pain medicines that are available over the counter. You should discuss, if you use these frequently, with your physician. There are certain patients that shouldn't take some of these medicines. For instance, if you have kidney damage, you shouldn't take ibuprofen or Aleve. If you have liver damage, you shouldn't take Tylenol. You should be careful about your Tylenol dosage. I'm sure everyone has heard in the news lately about Tylenol and the other makers of acetaminophen decreasing the recommended dose, and it's going from 4 grams a day down to 3 grams a day. I think that's because people just had a hard time keeping track of if they actually had 4 grams a day or not. But nonetheless, never take more than is recommended on a label. The studies show that aspirin and Tylenol are effective in some people, but ibuprofen and naproxen or Aleve tend to be more effective for more people in relieving headache symptoms once they've started. There are medications that are prescription medications that I'm not going to go into really, that have combinations with other chemicals and caffeine and things like that, but those are not really your first line treatment. You should start with these simple over-the-counter treatments, and they are more likely to cause medication overuse headaches and to cause problems in the future. So if you can get by with these, you're much better off. So preventative treatment, as I said, if you have frequent headaches, this is something you should discuss with your doctor. A lot of times this is necessary if having frequent headaches is causing depression or anxiety, which can occur. Obviously, if you're in pain all the time, you're not the happiest person. Amitriptyline, which is otherwise known as Elavil, that's the brand name, is the most commonly used of these. And you take a really low dose. That is a type of medication that's a tricyclic antidepressant, and I'm not going to go into all that. But it does have some pretty significant side effects. So if that's something that you are interested in discussing with your doctor, just be aware you'll start at a really low dose and increase slowly, and they'll be careful with it. Sometimes people will be put on other types of antidepressants or seizure medications to help Then there's a whole range of non-medication therapies that are a potential treatment for headaches, such as different types of behavioral therapies where you kind of figure out your triggers for what causes a headache and try to avoid these. If you notice these things starting, you try to combat them and reverse the effects. Acupuncture, physical therapy, these don't have as much studies and information on them as the drugs do, but that's a product of how our medical system works. So I don't have a lot of information to really recommend these things, but if you find that one particular thing works for you, or if you're interested in trying something for your headaches that does not involve taking a pill, talk to your doctor and they can probably refer you to somebody in the area to see about therapy or other options. So migraine headaches, this is the second most common type of primary headache. And once again, the cause isn't entirely known. In the middle of the last century, the prevailing thought was that this was due to narrowing and then dilation of blood vessels in your head. They now think that this is actually a result of the headache, not the cause of the headache, and that it's a nerve dysfunction that's causing it. We don't know exactly why, but there's tons of genetic studies and lots of specific information on it, but that's a little bit too detailed for our talk today. This one is pretty well inherited, and you see it runs in families a lot of times. If people have migraines, they have a sister or a mother or an aunt or grandmother or someone who also has migraine headaches. However, it's a very complex genetic system. It's not one gene that you inherit like some other diseases. Most common diseases are caused by complex genetics, so therefore difficult to understand. Let's see. So a migraine attack has 4 stages. The first stage is the prodrome, and not everyone can tell this. They could get moody, have an increased or decreased appetite, yawn, get constipated, and just not really feel like themselves. And a lot of people probably don't even realize that's what that is before their migraine attack happens, and that's 1 to 2 days before it happens. In a classic migraine, you'll have an aura, which is kind of a warning, and it's some strange sensory disturbances. Not everybody has these, though, that has migraines. This is just before the headache, and it can occur and continue during the headache. The most common type is a visual aura. You could have flashing lights, colors, something like that, but the most common is a bright light or other visual loss just to the side of your main area of focus. So it's not in the middle of your vision, and it spreads out. It usually stays on one side, and then when it resolves, it usually resolves in the same pattern. So it starts your vision starts coming back in the middle and then will fill in. And so sometimes you'll wind up with a C-shaped area of vision loss after a while. This is a good point to start trying treatment, because at this point you can tell, okay, I'm going to have a migraine. Other types of auras can be smell, any other sensory thing. The next most common type is a sensory as in your skin aura, and that can be numbness or tingling. And then when the headache actually hits, it's usually throbbing, usually one-sided. And they're generally limited to hours, but they can last days. Anybody who's had migraines probably knows they're sensitive to light and sound during those, and can get nauseated and vomit. And most people with a migraine will shut themselves in a dark room, go home, go to sleep. And I was taught in med school that sleep resets your migraine, but that's not always true, obviously, for people who have them that last days. But hopefully in most people you'll be able to kind of get rid of the headache with sleep, but migraines are generally treated with medication as well. And then after your headache resolves, you have what's called the postdrome, which is feeling drained or exhausted. Occasionally, though, it can be a feeling of happiness or euphoria, which is kind of strange. But these triggers are listed in order of prevalence. So the most common ones are here, and then they go down. There are lots of different triggers, but people who say their stress triggers headaches, that's very, very common. That is the most common for a migraine trigger. Female hormones being next common. A common type of migraine is what's called a menstrual migraine, which is one that occurs in the first couple days of a woman's menstrual cycle. I'm not going to read through all of these, but you can kind of read through and see And if you haven't thought of any of these before and you suffer from migraines, it might be something that sets off a light bulb, and you can try to avoid these triggers in the future.